Aurelia too, from the Aurelia group. So that's wonderful. No, I got to talk with the whole group. If I stand there, I'm talking in two directions. That doesn't work. Okay, this is the 20th anniversary year of the Stephen Lewis Foundation, and they have they're worried. They got a lot of challenges this year with the economic situation and the regional conflicts and all of the other health things too. COVID and gotta take my glasses off. Malaria, and I just heard this morning there's a new malaria vaccine, which is very exciting. But I wanted to mention that HIV is the deadliest pandemic of all time. Compared to COVID, which we've all just hopefully come through, we had 7 million deaths globally with COVID. There have been 40 million deaths from AIDS. So that kind of puts it in perspective. Even so, there's been enormous progress made in the last couple of decades regarding testing and access to antiretroviral drugs that can turn AIDS from a death sentence into a chronic disease. I listened to an interview on The Current on CBC Radio from January the 30th, in which Stephanie Nolan, who's a reporter and has spent 2 decades at least reporting on disease and stuff in Africa, and an African pediatrician stressed that although great progress has been made in testing and treating adults, it is children who are being left behind and driving the transmission. Ironically, this is because the emphasis has always been on controlling transmission by treating adults, who primarily transmit it through sexual activity. And of course, that's not an issue for children, so they didn't worry too much about children. On paper, in many countries, infants are supposed to be tested at birth, but frequently they are not because of lack of funds and poorly educated clinic staff. There's also the fear of admitting you or your child has the virus and taking drugs because of the stigma involved with that. As a result, only half of HIV-positive children in sub-Saharan Africa are receiving treatment. And of course, those children grow up very quickly. We all know how quickly our children grow up and become teenagers, and then they're out there in the big world. One of the solutions suggested was to improve access to testing in the community through education, especially geared towards teenagers. There are self-administered tests now. That's a big move. But many women don't know that they exist, and so they don't have access to them in the community. The other thing is support from peers and health workers to counteract the stigma so that people know they have some support and they'll be better accepted. This is where the Stephen Lewis Foundation has been so strong, supporting and educating women in the communities to push for their rights and advocate for themselves and their families. So that's all I'm going to say pretty much. I wanted to thank you again for your continuing support. You may have noticed we have a few used books here, which you can take home with a donation. And we have our cookbooks, which probably most of you already have one. But they're $20. If you'd like another one, if you've used yours right in the bag, you can come buy another one. We have a garage sale coming up on Beck Boulevard in Penetang on May the 27th, and our African-themed lunch at the Legion on October 16th. At that lunch, we're hoping to display a quilt made by the grandmothers groups across the country to celebrate the 20th anniversary. Our group really enjoyed getting together in January and rooting through our stashes. If there's any quilters here, you know about that, to find fabric for to contribute to the project. And we sent off some fabric, and we're hoping to find it when we see the quilt. We also hope to have a presence at the Midland Farmers Market during the summer, so stop by there and say hello if you see us there. Okay, I will find my numbers. Your table has a number. I'm going to, most of you have been here before, I'm going to draw a number randomly, and your table will go up to the inside. All right. The ladies over there will help you your food. All right. Number 1.
And now a video of you ladies. Is that?